you, Obel. Good morning.
Good morning.
I want to take this opportunity to recognize Barbara Hughes, the Chief of the Office of Health, Population and Nutrition, USAID, and really the entire USAID team, the whole team from Kenya PHARMA, led by Ruth, our partners in the room, KEMSA, who are our brothers and sisters, led by Dr. Munyu and the board. We appreciate your good work and all the implementing partners in the room, plus the media. Mine is going to be very brief, but when I was coming here, I was reflecting on some of the good and bad things, but the bad things weren't many, that we've had with Kenya PHARMA. And it felt like a divorce court day. Yes. You know, 6 years ago, I was just still new in NASCOP when I learned about Kenya PHARMA. And NASCOP then was the bride, or should we say the groom, and Kenya PHARMA was the bride. So NASCOP saw this beautiful bride and they entered into a relationship for the last 6 years. But today, as we stand here, I know some people in the room may feel like we are getting divorced, but I think we've had a good time together with many beautiful offsprings, like it was mentioned. You've heard that over time we've put together a good team. We have the order management team in place, we have the procurement committee in place, we have the quality improvement team in place, and I don't think there's any worry at all at this point, even if Kenya PHARMA is signing out, about the quality of drugs that Kenyans are receiving. Together with KEMSA, we have really worked together to ensure that HIV medicines or IV medicines are available at the right time, in the right place, to all the Kenyans. And when we started this journey together, talking about transition, we've had several meetings, as you've heard, and we had several concerns in terms of whether or not we are going to do a good job just like Kenya PHARMA have been doing. But I want to congratulate Kenya PHARMA for their time that they have taken and the skill to transfer the skills to the team that we now have. And I want to assure everyone that there's no doubt that you're in good hands. The drugs are going to arrive on time, good quality medicines are going to be there, and we don't have to worry. So I also want to thank the rest of the teams that we work together, and of course led by Caro then, you may just stand up. And now Susan, with the NASCOP team. Caro is now leading the Global Fund unit within NASCOP, but she was previously the head of commodities, HIV commodities, and now that role has been taken over by Susan. So Susan, you have a big task now, but no worry, you have our support. Asante sana. So some of the things that were challenging at the time when we were moving was the reporting issues. I know the ESMS system that Kenya PHARMA was using is not what we were using then, but of course we had access to it. But over time that has been transitioned, and I'm happy to report that we have now set up a team led by Susan in NASCOP that just does that, nothing else. We can now, at a click of a button, tell the stock status, and this has been institutionalized through the regular meetings that we've been having every month. I'm sure most of you are familiar with the two-pager report, which I'm sure most of you read. And now, that report, I'm told, and Munyu will confirm, that is going to be part and parcel of the HIV Situation Room for His Excellency the President. Yes. And that is going to be launched on 17th, I think. Yes, on 17th of this month. And therefore, what that means is, from the highest level of this country's leadership, we are going to be able to see whether or not patients have access to those drugs. So In summary, I just want to once again thank Kenya PHARMA for their support, and of course the USAID team led by Batuka, you heard is employed by USAID, but he's really an MOH person. Yes. He works for us and he works with us. When there's a shortage of a commodity somewhere, sometimes it's James who tells me, have you heard? There's this and that commodity missing in this corner, and we are happy to have him around. So thank you so much. I want to lastly just inform you that the chief guest, who is supposed to be the DMS, had delegated to Dr. Jackson Kioko, who is going to be with us shortly in the course of the discussion. Asante.